Well, we're excited to have a conversation today. It is Monday, January 20th, 2025. I'm Jessica Mayorga, and I'm the Chief Marketing Officer at Active Minds. And my co-host, I'll ask him to introduce himself.
Yeah, definitely excited to be a part of this conversation, Jessica. My name is Tyrrell Jeffries. I am the Director of K-12 Initiatives here at Active Minds. So I am honored to oversee all of our programmatic efforts in high schools and middle schools across the country.
And it's so great to have colleagues like Tyrrell because we're all looking at achieving the same goals in a number of different ways with great talent, skills, relationships, and interests all coming together to really move the needle and mobilize youth and young adults to make discussions around mental health more commonplace and to ensure that everyone knows that mental health is health. And that's a part of why we're here today. It's National Day of Service. It's also Dr. King's birthday. So much overlap there when we think about the legacy of Dr. King, how he taught us about service that isn't just service in the physical form, which is also so important, of volunteering at a soup kitchen or otherwise doing something like a community cleanup. But we at Active Minds have just learned so many other ways that we can serve by helping one another. I'll give a quick example and would love Tyrell to jump in as well. I know he has a lot to share about service and how we try to really weave service in to what our chapters do, our youth and young adults, and our work overall. And something that I've found to really personally hit home in our work here has been how we can offer service to others by being vulnerable and sharing our own experiences. Because it really helps to make people feel more comfortable sharing their own and really feeling like, okay, what I'm going through, I'm not alone in this. I recently had really the privilege of presenting to students from 13 HBCUs with our partners at Showtime and MTV. And I didn't realize the impact that me sharing a very personal story, sharing about some deep and dark moments in my life really had an impact on others. And I had no idea until the person running the event expressed to me that students left with a real impression from that. And that really made a difference in how they felt about talking about mental health. And so sometimes just sharing our own experiences is service. So I really want to always encourage people to do the same, that it's not bad to show what we've been through. If anything, it shows that we're stronger by it. Would love your thoughts, Sarah.
Jessica, that was so profound. Like, what a way to kick us off. I think it's that simple act of being vulnerable. Like, it's simple and it's simplistic in a lot of ways, but it's also very difficult. But like, what a gift to give someone like authenticity and like your authentic self and really build connection in a lot of different ways. I think about MLK Day, one of my favorite days as an educator. It was always so important. And we would always do so much leading up to the day because we usually had that day off of school. And to your point around what does service look like? I mean, there are often times that I really encourage my staff, like, take this day and do something for yourself, service yourself, as you are constantly servicing others every single day other than this one day that we have off. But I think it was back in 1994, Congress designated MLK Day as a National Day of Service. So really encouraging all of us to have a day on versus a day off. And that was always kind of conflicting for me as an educator that, you get a Monday off. It's a luxury. It's a gift. But there are so many different ways that you can get involved in service. And that story that you share, Jessica, is like so profound in the sense of like service is being there for others. It isn't always this grand gesture or grand gestures. It's about consistently showing up for others in their moments of need, listening, supporting, being very present. And I think those are qualities that are really deep rooted in Dr. King's philosophy of community and compassion. One of my favorite Dr. King quotes, I think one of the most important quotes that comes from Dr. King is life's most persistent and urgent question is, what are you doing for others? So really answering that question can be as simple as being reliable, being a reliable and a consistent presence in someone's life. And what a way to kind of reestablish that or really be focused on that on a day like today.
Yeah, and when you're talking about it as an educator, I have to say that it's also a day to honor educators because I was home yesterday with my 5 year old, and she's explaining to me that, oh, we don't have school on Monday. So I asked, do you know why? And she's like, yeah, because we are honoring Dr. King. I was excited. I was like, you're 5 and you know this? And I was like, what do you know about him? And she says, well, he taught us to be good people and to be good to everybody. And I was just like, oh my gosh, your teachers have done such an amazing job of just you're 5 and instilling this in you. And for her to say, they also taught us that we should do something nice for other people that day. So look at how National Day of Service and Dr. King's legacy just so organically come together at all ages, at all stages in life. As an educator, I'm sure that you influence other young people to really take away like what the whole point of um, having a National Day of Service is, why it's so important to honor and continue and build off of Dr. King's legacy. And I saw that right there in like my own child coming home with that. And all I can say is thank you to the educators who are planting that seed in our children. So that's a way of already doing, providing service even in advance of the National Day of Service, positioning others to be able to make something great out of that day. And I think that's another just example of what we do every day in our lives and our careers. We can touch people's lives by sharing information, by helping to mentor others. Those are ways of service. And we see that a lot in the chapter network that I know you can speak more to at Active Minds, because we see the youth and young adults who show up to help others talk about mental health, share their stories. Like they are sharing information on a really regular basis with the expectation and with the hope that they're going to be able to help even just one person. We know that if we can each make an impact in the life of one person in the world, what a huge impact that can have. But I would love your thoughts, especially since you work with youth and young adults, perhaps in a little different way than you have in other parts of your career.
Yeah, I mean, I think about my time as an educator, and to your point, thinking about how important it was that students understood why we are observing this day, why this day is so, why Dr. King's legacy is so important, and why service is so important, that we'd actually take a day off of school, right? And how sacred is learning time. And I really think about, Dr. King devoted his life to being there for others, advocating for civil rights, addressing systemic inequalities, and really just constantly reminding us what it means to show up for others, and that ripple effect that really brings about change in society, change in our world. And he recognized the struggles for like justice, inequality, and dignity. He recognized that those things were deeply tied to emotional and psychological well-being. And so, really, by being there for others, we can ease some of the burdens that often affect our mental health. And I think like the intersection of service, Dr. King's legacy, and mental health is like so profound. Service has a huge impact on mental health, both for those who are giving the service, both for those who are receiving. We foster connection by being there for others. We reduce isolation. We cultivate a sense of purpose. Really, all key components of overall mental well-being are tied to commitment to service. When I think about the youth and young adults that I work with now, they're so ambitious. They want to do so much. They are so knowledgeable. And they're so prepared to take action, but it is around like, okay, what is the appropriate action, and what are those ladders? What are the steps to the ladders that I'm building to really reach that overall goal, or reach some of those milestones? But for the youth and young adults that I work with, like I tell them all the time, showing up for friends and peers, having an open conversation around mental health, simply being a listening ear and practicing active listening. I think it's very easy to be in a conversation and think you're listening, but really you're listening to respond, or you're listening to figure out, okay, where do I fit in this? But really practicing active listening. Let me be present in this moment. Let me really focus on what I'm hearing and only respond to that. That really creates an environment of support. And I think Dr. King's legacy was really built on this idea of community support, being there for your fellow brother, being there for your sister, and really this idea of collective power really brings about change. And I think that starts with a commitment to service.
That that is so timely and deep, and I resonate so much with that. I appreciate that. And that also speaks to other parts of our work. And with our A.S.K program, and the three steps of acknowledge, support, and keep in touch. It's the active listening right there. How do you provide emotional support to a friend or a loved one in need of emotional support, whether it's something that might be considered really small or something that has a lot more of an impact on their day to day, on their well being, and being able to have those conversations where, because I found myself, especially in professional settings, where it's like, all right, let me write down what I'm about to say so I can jump in and say it instead of taking a step back and saying, all right, it's not so much about what I'm going to say, it's about the impact of what I can say. And am I really listening so that whatever it was that I thought I should say that I wrote down, that maybe there's something a whole lot better. Maybe there's something that I can contribute that can have much more of an impact if I'm really listening. And so when I think about it from the perspective of service, how am I actually going to help somebody if I'm making it about me? It's how do you selflessly make your time about somebody else? Because that's where the service piece comes in. And it's how am I going to intentionally use my time to help my brother or my sister? How am I going to use my time to make sure that someone feels heard and seen? Because that's service. So being able to tie that all, like you mentioned, into mental health, that's really essential. That's what's at the center of being able to be there for somebody else, in my opinion.
No, I agree completely. When hearing you, I think about like acts of service, and so whether that's advocacy, whether that's volunteering, or whether it's like simple kindness, as we've been discussing, it really helps to build that interconnected community, and that's what Dr. King envisioned for all of us: a place where everyone feels valued, everyone feels supported, everyone's needs are addressed within the community. The community is a place that you go to get those resources. And I love that you mentioned ask, because there could definitely be some youth and young adults who are listening to us right now, and they're at home and they're taking this day off of school, really taking advantage of this mental break of like going to ask, going to our website, completing the ask experience, and then actually having a conversation today could be one of the ways that you live out that service that Dr. King was talking about. And you may not even have to leave your home to do it. It's those small acts with big impact is what I think about. So like checking in with a friend, joining a support group, volunteering for mental health initiatives, really embodying the essence of what it means to be there for others. And really, as I think about the young people who may be listening, I really want to encourage you to embrace service as a way to live out Dr. King's ideas and legacy. Embrace it as a way of make it a lifestyle. So whether it's a classmate who's struggling, whether you are thinking about what mental health resources are needed in my school, whether you want to start a peer support group, you want to start an activized chapter to really foster a sense of belonging and community, like really today is a day to commit to making service a way of life.
I agree. And when you're talking about making that space for others, I think about when we took our Send Silence packing exhibit to a local university. And we were really excited to have members of their football team volunteer and help out that day. And there was one member of the team in particular who was passing out the maps to the exhibit and just stopping people and talking to them about why it was important for them to pause and take a few minutes to go through the exhibit. And he would take that time to also talk about his very personal mental health struggle. And we had some media covering, and he's like, I want to speak. I want to bring people together. That's service. Like him just even pausing and finding another student walking down the mall of the school and being able to say, this is really important to me. Can I talk to you about this? Can I give you a map? Can I tell you what this is about? And then wanting to talk to broader public about it. And he had the platform of being an athlete, maybe being a little more well known than a fellow student, and utilizing that platform. The same thing can be said for people who have large followings on social media. How are you using that platform in a way that really shares or promotes service? It's great if you have a lot of people who are your fans or your followers or people who want to interact with you, but service right there is using that platform to help others learn and others get engaged.
Yeah, I completely agree. It kind of makes me think about our mental health advocacy academy. It makes me think about the commitment that those high school students are making at the end of the academy to really go and implement their advocacy action campaign within their schools and within their communities. So the learning, the commitment to learning a service, the actual crafting of the advocacy campaign, getting feedback, making sure that it's equitable and it's fair, that it's really reaching BIPOC and LGBTQ plus community members, and then actually going to do it is service. And we teach them like oftentimes you don't want to do this work alone. So we talk about coalition building. We even talk about going to people who you may be seen as potential opposition to you being able to implement your plan and involving their voice as well. Our advocacy academy, those high school students are truly committed to service, and by being a part of the academy, it speaks for themselves, and they're making service really a part of their lifestyle, and that really made me think of our academy students.
Yeah, you're making me think. Actually, I had a conversation with a colleague that I know we both love dearly, and she mentioned in a conversation earlier that she had been reading, and she retained this guidance in life about the boldness in the face of opposition. And so, what you just mentioned is like so tied to that, because even when there are people who may not be bought in of like, yeah, we need to spend more time talking about mental health, or not bought in that we can create safe space, that people can create safe spaces and support one another, listen to them and engage them, and bring their voice to the table. I think when people feel heard, they're more willing to listen as well. So I really appreciate you sharing that, because it is so important to always consider who's thinking differently, because they might need the support that I can offer and not know it.
Yeah, and I think about like how our program specifically, like as we have been really focused on K-12 expansion and really the power of education and even the charge that Dr. King gave to education, that like we want to make sure that we're building their character as well as their academic prowess, right? Our peer power mental health curriculum for high school students really is a foundational piece of community, but also this idea of what am I doing for myself and for others. So I often tell students that oftentimes as young advocates, you got to make sure that you are focused on your own mental health. And if you have practices put in place for yourself, it's easy to share those things with peers. And I think about our high school curriculum oftentimes is around like, how do we set a foundation for the appropriate conversation? And our students lead those conversations. And you learn so much about what they care about, what they're dealing with, what their fears are, what their passions are, by really allowing them to lead the conversation. And the more that the student is leading, more students are involved, and you really get to hear so much authenticity from students. And I just think about like how that space alone is a place in which not only can we really think about how do we take care of ourselves, but we learn from the stories, going back to how you even started this. We learn about hearing from others. So when you hear about what others are doing, maybe they're going through something, how they overcame it, like we can implement those practices in our own life. So I really thought about like how within our club settings, even within our curriculum, there is a level of vulnerability. You want to be honest, you want to be transparent. And how do we teach young people to learn from each other and really learn about what are the healthy habits that we should be replicating? How do we deal with those conflicts and those things in our life? So I really love how a lot of our programs and a lot of what we are teaching our youth and young adults is tied to service, because we don't want them to just gather the knowledge and just hold it to themselves. How are you advocating for others? How are you sharing this with others is really the foundation of a lot of our programs.
Yeah, and it makes me think that we have the responsibility as individuals who want to be advocates, as individuals who are really committed to lifting stigma, to making it commonplace to talk about mental health, that we have that obligation of, we have the information or the training or the experiences, that service is sharing that, like we mentioned before, not only talking about it, but finding vehicles to share that, whether it's an event on a campus, whether it be a college or a high school, or um, spending time really helping younger generations. So our college students who sometimes interact with high school students to share what they're learning, what their experiences have been. I think that's how generationally also we're going to see the needle move so much in how mental health is talked about and treated in this country and beyond. And that all, to me, just comes right back to service, right back to Dr. King's legacy, because he learned experience so much, and he didn't just take those experiences and keep them to himself. In every possible channel he had, he shared those, and that became fruit for so many people's labor.
Yeah, I really think about how a lot of Dr. King's work was, really rooted in equity and justice. And really thinking about one of the things that we are doing at Active Minds is really focusing on how do we ensure that our programs and our resources are reaching a wide range of students. And even when we think about putting an emphasis on supporting BIPOC and LGBTQ plus students, and then thinking about the fact that high school serve all students, like the K-12 system serves all kinds of students. Really thinking about how do we make sure that our programs reach all, but then all specifically allow those BIPOC students or LGBTQ plus students to be seen within our programs. And I think about this piece of equity and justice is so important in terms of service. Like, how do we ensure that those services are reaching some of those that typically they were left out of, or typically it hasn't always been accessible for them? Mental health is for everyone. We all have mental health. So mental health resources are for everyone. It should be available for everyone.
Yeah, absolutely. I'm thinking of some of the work that we're looking at how do we ensure that resources are available oftentimes in other languages or in other ways so that everyone feels like they have the information to pay more attention to their mental health, to, like we've mentioned a couple of times, support others and really identifying what are some of the like barriers to entry for being part of the mental health conversation and finding what you need. And I think that's also a big part of the work we're doing, especially the work that you and your team are doing of like, how do we make it so that students, especially youth and young adults, are accessing information the way they need to. I would love to get your thoughts, especially you've been on both sides of it, right? Working in the school building and in administration in the classroom, and now as you're approaching administrators and others from the organizational side, what you see as perhaps barriers to entry and how you're seeing our work having that impact, or not even barriers to entry necessarily, but opportunities.
No, very good question. I mean, something that you said earlier really made me think about like this idea of mental health equity. And it's a Dr. King always talked about the beloved community, right? He envisioned this beloved community. So mental health equity is a critical part of creating this beloved community that Dr. King envisioned, and now that work is left up to us as we continue on his legacy. So really by addressing systemic barriers and thinking about them and really being focused on increasing access to mental health resources, we honor that legacy. One of the things I think about being a former educator and really focusing on expanding our programmatic efforts in the K-12 field is oftentimes addressing mental health within the education system can be very daunting and scary. And it's like, if I open this door, am I prepared to deal with all the things that I'm about to walk through? Even as being single is like, I don't have a counselor. So if we start this club and all these things come up, what do we do? But I think one of the things that I try to encourage educators to see and really recognize that, okay, for a long time in my career, and I apologize to my students, I did not make mental health a part of our overall academic success plan. And it should be. We're focused on getting the kids into the building, so we want attendance. We're focused on making sure that they're learning, so we want to see academic gains. We're focused on student culture, so we want students behaving. And then also, you should want joy. We always talked about producing positive academic emotions. And I really sat back and thought about there was a long time in my career as a principal that I did not think about how am I ensuring that my students have healthy mental health experiences in order to open the door for all of those other things. We want students to show up and we want them to feel connected to school. How are we ensuring that their mental health is protected, that their mental well-being is at the forefront of all the things that we ask of them on the daily and of all the responsibilities and the goals that the school has set in front of them for one academic year? I think about, coming back from COVID and, I still have this conversation with educators. There's a huge emphasis on, responding to the COVID academic loss and making those academic gains. And for a long time, we did not see students catching up. And the question was, why? Why? And it's like, well, maybe they didn't have the mental capacity. Did we ever stop to even think about the fact that students went from being in a building, to having to learn from their computer, to doing it hybrid, to then going back full time. And then the entire time there was this fear of, like, are we going to be exposed to this sickness? Did we ever really stop and think about how we're prioritizing their mental health, in addition to the fact that they're behind in reading, in addition to the fact that they're behind in math, and really allowing them having a healthy mental health experience, really being strong in their mental health prowess to be the foundation for those academic gains. And so oftentimes when I'm talking to school leaders and I'm thinking about, okay, what are all the things that I know are on your plate? How do I ensure that our programs are really supporting those things? If you want your students to succeed academically, if you want them to have positive academic emotions, you want a well-behaved, positive school culture, mental health has to be prioritized, and it can't be taboo. It has to be something that every single person within the school building, from the principal to the janitor to the teacher, from the student, we're talking about it and we're invested in it.
Yeah, absolutely. And I think that's definitely one of the best types of service that your work is doing
Absolutely.
and your team is doing, the organization is doing, right? Because we want to ensure that everyone is positioned and ready to go to be able to have those conversations. And we don't have to be professionals at it. Obviously, there's a drought in mental health professionals, so that's always a topic that we should definitely discuss another time because we do want to promote having individuals really dedicate their talents and their time to professionally being in the space of mental health. But you don't have to be a mental health professional to help to really improve outcomes, to be able to even check in on students like, hey, where do you have that joy? Because bringing that joy to the classroom, bringing that joy to the workplace, no matter where you are, makes such a difference for yourself and for others. That joy can be contagious. And sometimes it's what somebody needs. And having a colleague across from me earlier today who was just really happy about something and engaged me in conversation, that helped me level set. And just having that human contact, she didn't know that she was providing me with a service as I was dealing with a challenge. So we can show up and serve one another in the tiniest ways that makes such a difference.
No, I agree completely. And I think about oftentimes, you named earlier, this is also a day to honor educators. And I completely agree with that. So shout out to all of our educators who are listening, whether you're a principal, a teacher, a classroom assistant, a lunchroom volunteer. Thank you, thank you, thank you, thank you. But you made such a good point around like this idea of being a mental health professional. And I think that is the beauty of what we are trying to do here at Active Minds. And the power of our programs is that you do not have to be a mental health professional. In a lot of ways, it's the opposite of that. I think about Dr. King's legacy, and we talk about his legacy, and I often really, really think about how short his life was, but how much he did, and that's because he got started so early on. We know a lot about how, he graduated high school early, how early he graduated college, but he started his life of service very early on as a young person. He's a perfect example of how, as a young person, you can really take charge and you can lead a movement. You don't just have to be a part of it. You can lead this mental health movement if you so choose to. But I think that's the beauty of our programs. I often tell educators is we want students leading. Just like Dr. King did at a young age, we want students leading. And Dr. King's legacy is so long and so profound, but it's in a short amount of time. But it's because he was activated as a young person. So to those young people who are listening to us, today is the day that you can start leading. Today is the day that you can really be at the front lines of making mental health the norm, making mental health the priority within your school, within your home, within your community. And just like Dr. King did as a young person, uh, your story is yet to be written in terms of how profound and how much of an impact you can have. I think about that all the time. Like I think oftentimes people forget, just because like if Dr. King hadn't been assassinated, he could still be alive today. He could very well still be, living and impacting our society and impacting our country. Because he got started so young. So to those young people, you are not too young to get started. You're not too young to go to school tomorrow and have a meeting with their principal or with that trusted teacher and let them know, hey, I'm looking for a way that our school can prioritize mental health.
It has been so awesome to talk to you. I always love talking to you, that. We'll have many more conversations ahead. And for anyone who's listening to us on our debut of these conversations, we look forward to bringing in some great friends and leaders who have a lot to share, who will help to hopefully inspire others to continue this work and move it forward. Anything else? Did I miss anything, Tyrrell, that you wanted to share?
No, likewise, Jessica. Love talking with you. I can't wait to our next conversation. Please share this with the youth and young adults in your life. Share it with others who are passionate about mental health. And if you're curious more about our organization and our programs, head to activeminds.org. There's so many resources, so many things that you can learn about the work that we're doing. We would love to have you join our network and be a part of our mental health movement.
Yes, and you can find us on the site and connect with us directly, and we'll make sure to put you in touch with the right people in the organization to help further your interest in doing more in your communities. But I hope everyone has a wonderful and really peaceful day of service, and continuing to honor Dr. King. Let's live out the aspects of his legacy that we are positioned to do. So awesome. Thank you so much, Tyrrell. And again, have a great day, especially educators out there who are making a daily difference.
Exactly. Check out our social pages as well. Have a great rest of your day, Jessica.
Thank you, you too.